Informed consent is a process of communication between a patient and a physician that results in the patient's authorization of agreement to undergo a specific medical intervention. A physician must seek an informed written consent prior to performing a diagnostic or any treatment procedure in the operation room. This consent should be taken from the patient if he is above 16 years old, but in the case of minors or unconscious patients, this consent can be taken from their legal guardians, their relative, or maybe their significant other. This informed consent is very important in the law of medical ethics. But if there is an emergency and nobody is available to sign the consent in behalf of the patient, then it is the responsibility of the physician to start the treatment. But it is obligatory for the physician to explain the nature of the procedure and the expected result. Today, we will look at the scene of a physician asking for their patient to give an informed consent. This patient has appendicitis and he is required to get appendectomy. Good evening, I'm Dr. Karina, the surgeon on call for today. So, we've gotten your results blood test back, and we found out there are an increased marker of infection, and this shows that there is a diagnosis of appendicitis. Okay, do you know what appendicitis is?
No, doctor. What is appendicitis?
Okay, so basically, appendicitis is an inflammation of your appendix. Do you know what an appendix is? Let me explain for you a bit. Okay, so basically, for example, this is your body, and this is your abdomen, this is your intestine. And further down on the right side of your intestine, the area you feel the pain, here there is attached a small pouch. And this small pouch is an appendix. So appendix, generally it doesn't help, or it doesn't disturb your digestion. But when it gets blocked or when it is infected, then it is inflamed, and then you start to feel these symptoms of pain and cramps on your right side of your abdomen. So what we recommend for today for you is to have an operation that we call appendectomy, which is to remove your appendix so that this inflamed area will not spread to other organs.
What is the test or treatment, doctor?
Okay, so like I said, it's a operation where we remove your appendix, and then we have two options. So it's either you use open surgery, open operation, or we use a method called laparoscopic. So if it's open surgery, basically it's by having a big incision, and we cut open your abdomen and then we remove that appendix. If we use the laparoscopic method, it's by inserting a small special surgical tool which has a camera. Okay, and then by inserting that, we try to remove it from internally. We can use the laparoscopic method, but in case of any complications which result that your appendix will burst or rupture, then we will have to do the open surgery. So in this consent form, I will put a, when you sign, it will be a consent to both of the surgeries, okay?
Okay.
Alright.
So how will the test or treatment help me?
Okay, so in your case, the only way for you, for a treatment for you, is to remove the infected appendix, the inflamed appendix, because if we don't remove, the infection can spread. By removing the appendix, we can remove that area which is infected so that it does not spread around, which can cause much more complications.
Okay. But I'm scared, doctor. Can the operation cause any complications or problems?
Okay, yes. The main complication that can happen is that if your appendix bursts. So when it bursts, the infection inside, it can spread to the walls and the organs beside. and that is dangerous because it can cause inflammation, and we call that peritonitis. And if peritonitis happens, it will cause a very serious complication. But the thing is, if you don't remove, you can also get peritonitis. So unfortunately, the best option is for you to have the appendectomy.
What happens after the surgery?
In that period of post-operative period, your belly will be a little bit swollen, and then you will have pain in your shoulders for about 24 hours. You will also feel sick to your stomach. You can feel nauseous, diarrhea, constipation. Those are very common effects after the operation.
How long will it take for me to get better?
In normal patient, usually they will get better from 1 to 3 weeks after the surgery.
So why do I have to give consent and need to sign the form?
Okay, so the important necessity why you have to give consent is that we want to make sure that you affirm to any procedures that we will operate on you, and you know every detail and you accept that. This is the consent form. You have to sign here. I will give you time to discuss with your family if you need to. You can ask me more questions in detail if you want. Decisions should be made as soon as possible after we diagnose that you have appendicitis, because we fear that the appendix, like I said, would rupture. So as soon as possible, we want to do this operation.
I see. Okay, so based on your explanation, I think I'm well informed. Thank you, doctor. I've made my decision to go with the operation.
Okay.
I will sign now and tell my family later.
All right. Do here and here. Okay. Thank you. I will meet you for preparation. The nurse will come and take you details after.
Okay. Thank you, doctor.